Hello, let's come on practice with my kids. IV cannulation. The tourniquet was tied or on the hand in a wrong manner. If you will be tying it completely like this, it will be leading to the hairs get stuck in the tourniquet, and while removing, it will be very painful. So this is the correct manner. You need to just have a tie so that once you open, easily it comes out. So here, while cleaning with the alcohol swab, you need to clean just with one stroke. That is enough. No need of cleaning again and again. It will be making the area unclean because of the repeated strokes. When you are going to insert the cannula, be confident. Just stretch the skin with one of the thumb so that the cannula can be easily inserted in the vein. So there, however, he was stuck off. So again, we are trying to do for the another person. So first, you need to keep all the supplies ready with your flush, cannula, tourniquet, and the plasters also. Palpate the vein, tap on the vein, or else if you are not able to find the vein, if you tap on the vein, it will comes like bulge or become the veins will become anger. Usually I say that if you are not finding the vein properly, tap on the vein. Once you tap or beat on it, light slowly, not too harshly, slightly, then the vein will become anger and come up like this. Yes, like this. So once you do it, you can feel the vein. Once you feel the vein, make sure you are going to insert the cannula right straight over there. Always try to select the straight veins, no bifurcation side, no small veins, or already if there is cannulation done at the side, do not select that type of veins. Okay, select a vein which is straight and can be visible. It should be away from the joints. Joints is like contraindicated for the IV cannulation because the patient keeps on moving, and that will be leading the vein, the cannula to be out from the vein or injure the vein, and that causes the medication get past it, the surrounding tissues. Okay, so here once you insert the cannula, you see the vein is still not straight. Okay, but still they are trying to do so. Do not take it completely out like this. Once you have insert, go directly inside, not coming out again going. That will be causing to the injury to the surrounding tissues of the vein. So then again it's out, trying to do for the another person. So here, ask the patient to open and close the fist so that it will give you a good clear. No, this is also not correct. With the thumb, stretch the skin so that the vein will become like a straight one, not so lumpy, moving in the sides. Okay, so still this is also not a proper way of inserting the cannula, but still they're trying to do. I have asked them to take a very small cannula, and everyone's hand was already pricked with the cannula, so we have taken a new like a mannequin. So here, oh my god, this still it is out from the cannula. It's a wrong try. Okay, so what you're going to do first, the tourniquet is also not tied properly. Once you are going to insert the cannula, you must maintain the degree 15 to 30 degrees of the cannula angle to insert in the vein. Once you have done it, okay, good. The stellate is out, three ways connected, tourniquet is removed. Okay, here. Once you have connected the three-way, you need to first aspirate, check the blood flow, whether the cannula is in the right place or not. Then flush and see for any edema, swelling at the site. Then place the plaster. And here, my kid have not placed the plaster also properly. I guess the plaster must cover the cannula. Okay, and yeah, now they are trying to flush it and see. Still the cannula is not properly. Yes, excellent. This is how we are going to place the plaster to cover complete cannula, not the three-way. Okay, remember you are not going to cover the three-way. Only you are going to plaster the cannula. Here another hand we have taken like a mannequin in order to practice for the cannulation. Here my major aspect is my kids must know what the steps to be followed at the time of cannulation, not just doing the cannulation. However, with the practice we get the vein, they can able to learn how to insert the cannula, but the steps is pretty much important over here. So the long time tourniquet tie should not be there. That will be leading to have like injury to the tissues, blood cells, and so on. So once the tourniquet, first keep all your supplies ready. So that will not be delaying you to have like tourniquet tie for the long time. Okay, excellent. This is only in the one stroke. They have clean up the site of cannulation. Once done, what you are going to do, from the tourniquet at least 3 to 4 fingers far from the tourniquet you need to do the cannula insertion. Okay, or else for the patients it will be leading to have sudden swelling at the side because of injury. Okay, and blood pressure at the side due to the the tourniquet tie. Okay, so once this is good one, you have connected the three-way, but forget to flush it before. Aspirate it, then flush it, and check the cannulation completely properly done or not. So here the plaster must be tied. No, the plaster must be on the cannula. Okay, so once done, it was again a wrong. So here again another one. Yeah. Okay, the tourniquet is tied little wrong way. You see already the hands are completely pricked. Before the tourniquet tie, we must check and confirm the size of cannula what we are going to apply for the patient. Okay, or what you are going to use for your patient, not after tying the tourniquet. If you are going to collect the blood sample from that side for the first time, if you keep the cannula, yes, you can collect the blood sample in order to send your blood specimen. But if you are going to tie the tourniquet for the long time, it will be leading to have the potassium high, because the potassium levels will become high if you keep the cannula or tourniquet long time. Okay, it give you the faulty results as well as ammonia also. So you need to keep all your supplies ready first before tying up the tourniquet and insertion side. Okay, inserting at the side. Colleagues are helping my kid to keep the cannula properly, but still, however, are the complications of the cannula. Okay, first we will see the contraindications. First, identify the patient, whether they are having any AV fistula at the side or mastectomy, or patient was paralyzed at the side. That areas or that side of the body to be avoided at the time of cannulation. Okay, the and joints area, burns, injury, infection, site of the body to be avoided for the cannulation also. Coming to the complications of the cannulation, we are having two types of complications, local complication and the systemic complication. The local complications are the complications what you can see at the site of the cannulation, such as inflammation, edema, tenderness, redness, swelling you can see, whereas the systemic complications can be pulmonary embolism, sepsis, septic shock. Okay, that can be the systemic complications. The indications for the IV cannulation is medication administration, blood and blood products administration, IV fluid administration, total parenteral nutrition, etc. IV cannula, also known as peripheral cannulation, PVC. Okay, peripheral venous catheter or cannula. So this is just a general idea. Coming to the cannulas, we are having different sizes of cannula of different cages, 16, 18, 20 we can use for the blood and blood products administration, whereas the 22, 24, 26 we use for the medication administration or fluid administration. 24 and 26 is for the pediatric use, whereas 22, 20 from here all we use for the adult patients based on their vein size. Here we are going to do the blood collection, blood sample collection. So at the antecubital fossa, just before the site of insertion, remember the tourniquet is not tied properly. It's 3 to 4 fingers above or 15 centimeters above from the site of the needle insertion in the vein. Okay, however, they have collected the blood, immediately remove the tourniquet, place the gauze and plaster it. That's it. Okay, I'm so grateful you're till over here. Thank you. Bye bye. Take care.